Before you even think about your heart, your blood sugar, your joints, or your sleep, take a moment and look at something much smaller, your fingernails. Most of us do not pay much attention to them unless they break, snag on clothing, or start looking different. But after 60, those small changes can become harder to ignore. Maybe your nails split more easily than they used to. Maybe they have ridges now. Maybe one nail looks thicker, yellow, dull, or lifted. Maybe you have noticed a dark line and wondered whether it is from an old injury, or whether it means something more, and that is the question this video is really about. When your fingernails change after 60, is it just aging, or is your body trying to tell you something? The honest answer is, sometimes it is aging, sometimes it is everyday wear and tear, and sometimes it is a clue worth bringing to your doctor. Your nails cannot diagnose a medical condition. They are not a warning system that tells you exactly what is happening inside your body, but they are living tissue. They grow from the body. They are affected by age, moisture, circulation, nutrition, inflammation, infection, medications, and certain health conditions. So when they change, the goal is not to panic. The goal is to notice the pattern. As we get older, nails often grow more slowly. That one change alone can make a big difference. A nail that grows slowly is exposed longer to water, soaps, sanitizers, dry air, cleaning products, and the small bumps and stress of everyday life. Over time, this can make nails more brittle. They may peel at the tips, crack more easily, or split when you barely hit them against something. Many people see this and immediately think, I must be missing a vitamin. That may be possible in some cases, but it is not the first conclusion to jump to. Brittle nails after 60 can be related to normal aging. They can also be made worse by frequent hand washing, dry weather, nail polish remover, gel manicures, cleaning chemicals, or repeated trauma to the nail. In other words, sometimes the problem is not one dramatic disease. Sometimes it is years of small stress on a slower growing nail, but that does not mean every change should be dismissed. A useful question is this: did the change happen gradually, across many nails, or did one nail suddenly start looking different? That difference matters. Take vertical ridges, for example. These are the lines that run from the base of the nail toward the tip. For many older adults, vertical ridges become more visible with age. In many cases, they are like wrinkles in the nail, a change in texture over time. But if the ridges are new, dramatic, painful, or appear with other changes, it is reasonable to ask a healthcare professional about them. The mistake is going too far in either direction. Some people assume every ridge means a serious deficiency. Others assume every change is just old age. A smarter approach is to watch for patterns that are new, persistent, worsening, painful, or very different from your usual nails. One change worth noticing is a spoon-like nail. This is when the nail becomes thin and curves upward, almost like it could hold a tiny drop of water. Spoon-shaped nails can sometimes be linked to iron deficiency, anemia, or other medical issues. It does not mean you definitely have anemia, but it is the kind of clue that is worth mentioning at a medical visit, especially if you also feel unusually tired, weak, short of breath, or unlike yourself. Another pattern is a nail that becomes thick, yellow, white, brown, crumbly, or lifted from the nail bed. This can sometimes be related to a fungal infection, which becomes more common with age. Many people think of nail fungus as only cosmetic, but for older adults, especially people with diabetes, poor circulation, or immune concerns, nail changes deserve more attention. A thickened or damaged nail can cause discomfort, pressure, irritation, and skin problems around the nail. Nail changes can also happen with inflammatory skin conditions. Psoriasis, for example, can affect the nails. It may cause tiny pits, roughness, discoloration, lifting, grooves, or crumbling. Sometimes the nail is one of the places where inflammation becomes visible. Thyroid problems can also sometimes affect the nails. Some people may notice nails that are dry, brittle, thick, peeling, slow growing, or lifting. Again, the nail alone does not diagnose a thyroid condition. But if nail changes appear along with feeling unusually cold, fatigue, dry skin, hair changes, weight changes, or changes in heart rhythm, it is worth asking your doctor whether it should be evaluated. Now, there is one nail change that should be taken especially seriously: a new or changing dark streak. A dark line under a nail can happen for different reasons. It may come from trauma. In some people, nail pigmentation can be harmless, but in some cases, a dark streak can be related to melanoma under the nail. That does not mean you should panic if you see a line, but it does mean you should not ignore a new dark streak, especially if it is widening, changing, affects only one nail, comes with nail splitting or lifting, or the skin around the nail becomes darker. That is a good reason to see a dermatologist or a qualified healthcare professional. The bigger lesson is simple. Nail changes are not about one sign meaning one disease. They are about patterns. Are several nails slowly becoming a little more ridged over the years? That may be age-related. Is one nail suddenly changing color, shape, thickness, or texture? That deserves more attention. Are the nails painful, swollen, infected looking, bleeding, lifting, or rapidly worsening? That should not be ignored. So what can you do safely? Start by simply paying attention. Look at your nails in good light once in a while. Notice their color, thickness, shape, texture, and whether one nail looks different from the rest. Keep nails clean, dry, and trimmed. Moisturize your hands, nails, and cuticles, especially after washing. If you do a lot of cleaning, dishwashing, or wet work, gloves can reduce repeated exposure to water and harsh products. Try not to pick at your nails or cut your cuticles aggressively. The cuticle helps protect the area where the nail grows. Damaging it can make irritation more likely. And be careful with the idea that a hair, skin, and nail supplement is automatically the answer. Many older adults take supplements hoping to strengthen their nails. But supplements are not always harmless, especially if you take prescription medications or manage chronic health conditions. If you are concerned about nutrition, the safest step is not guessing. It is asking your healthcare provider whether your symptoms, diet, medications, or medical history suggest a need for testing or guidance. You should also talk with a healthcare professional if a nail change is sudden, severe, persistent, worsening, painful, infected looking, or unusual for you. Redness, swelling, pus, bleeding, nail lifting, a new dark streak, or one nail changing much faster than the others should be checked. Most nail changes are not emergencies. Many are related to aging, dryness, trauma, or everyday exposure. But after 60, paying attention to small body signals can help you notice when something deserves a closer look. Your fingernails may not tell you exactly what is wrong, but they can tell you that something has changed, and that is the point. Do not fear every ridge, crack, or color change, but do not automatically dismiss your nails as unimportant either. They are part of your body's surface story, shaped by time, daily habits, health conditions, and sometimes signals from deeper inside. After 60, one of the most useful health habits is learning how to notice change without jumping to conclusions. That means staying calm, staying curious, and knowing when to ask for help. If you want more clear, serious explanations of the body signals that can appear after 60, subscribe to the channel and keep learning how to listen to your body with less fear and more understanding.